All right, diving in today, and we're looking at something pretty fascinating. Dance movement therapy, DMT for short.
Yeah.
And, at first glance, you might think, oh, it's just moving around, but it's so much more than that. It's really a distinct approach in mental health that uses movement, how our bodies move, as like the main tool to understand and then address, our thoughts and feelings.
Mm.
And we've got some great material here today. It gives us like a really comprehensive look at the whole field. So everything from like the core ideas behind it to how it can be used to help all kinds of people, and even the research that's helping it, keep evolving and all that.
Yeah, exactly. And for you listening, if you're someone who likes to kind of cut to the chase, get to that good information quickly, and appreciates those aha moments, those insights, but without getting overwhelmed by too much information, then this is really the exploration for you. Yeah. We've really tried to distill it down to those essential elements to bring you a really clear and engaging look at some of DMT's most fundamental principles and just some really insightful ways that it can be applied.
I like that. Cut to the chase. That's what we like to do here. So, goal for today, pretty simple. We want to unpack what is DMT, how does it actually work, and why is it become, it already is, but why is it such a significant approach, and not just in mental health specifically, but really for, well-being in a bigger sense.
Yeah, right. It's broader than just the clinical setting.
Okay, so let's jump right in. One of the books we've got here really hits on this idea that DMT is both an art and a science. It's not just one or the other, it's both. So when we look at where those two kind of, meet art and science in DMT, what jumps out at you?
Well, I think what's really interesting is how they intersect through the exploration of patterns.
Okay.
And we're talking about recurring sequences in time, in space, and in movement.
Okay.
And so the act of noticing those patterns and then actually creating them is very central because it leads to understanding, it leads to meaning creation, much like in art, like when an artist creates a work or a scientist makes a discovery.
So it's not just about like the feeling of moving, it's actually about observing and really like making sense of those patterns, right, as they're happening.
Exactly. Yeah.
That's really interesting. And it sounds like, this isn't something that's just happening in isolation.
Right.
DMT is connected to a lot of other fields too, isn't it?
Well, yeah, absolutely. And if you kind of zoom out and look at the bigger picture, DMT is increasingly becoming a part of these interdisciplinary mental health teams.
Mm-hmm.
And it's also pretty cool to note how much this profession has grown globally since it was first formally organized here in the U.S. over 40 years ago. We see professionals from all sorts of different cultures, Spain, North and South America, Israel, Australia. They've all contributed to, how it's developed.
So we've got all these different perspectives coming together. It's awesome. Now, like any field, I'm sure there are some, people who are really instrumental in shaping DMT. Who are some of the key figures that we should know about?
That's a great question. That raises a point about the historical foundation. And Marion Chase is definitely a central figure here. Her pioneering work at St. Elizabeth's Hospital, that was absolutely foundational. And she served as the first president of the American Dance Therapy Association in the late 60s. Her work really laid the groundwork for what we now consider a very relational and empathetic model within DMT.
So what was it specifically about Chase's way of working that made it so influential?
Well, what we learned from the sources is that she was very attuned to her patients. And her sessions, they would begin with waltz music.
Oh, that's cool.
Yeah. And she paid very close attention to their moods and how they were interacting or not interacting with the group, right? And she was really skilled at creating this safe and accepting space, validating their movement expressions and responding to them directly. Even those who might have kind of stayed on the periphery were acknowledged in their own way, So it paints this picture of connecting with people who might have felt very isolated or alone.
Yeah, that makes sense. Really human-centered approach. Now, were there any other sort of key figures that brought other ideas, to the field?
Yeah, so Mary Whitehouse is another significant name, and she often worked in a more traditional dance studio setting with individuals who had more movement experience. And her focus tended to be more on their internal experiences, tapping into active imagination, with the therapist kind of acting as a supportive witness to their process. And then there's Trudy Scoop. She introduced this very compelling concept she called fear.
Fear, okay.
Yeah. And she described it as a kind of primal archetypal fear that exists as an unconscious potential in all of us, distinct from the kind of conscious fears we can identify readily, And she kind of illustrated how everyday situations could actually trigger these deeper emotional responses linked to this fundamental earth fear.
Mm.
So this idea really highlights how our present experiences can resonate with those very deep-seated emotional patterns.
I like that. That's really interesting, this instinctual level of fear that's kind of influencing us all the time.
Yeah, exactly.
Okay, so let's dig into some of those core concepts and theories that really make up, the foundation of DMT. We hear a lot about creativity, spontaneity. How do those concepts kind of fit in?
Well, what's interesting here is the distinction that's made between, on the one hand, originality and spontaneity, and on the other hand, the broader concept of creativity.
Gotcha.
While they're related to this notion of fluid expression, they're not considered identical.
Okay.
And spontaneity, much like Freud's concept of free association in verbal therapy, allows for unconscious material to surface by kind of reducing our usual conscious control over what we express.
Makes sense.
So spontaneity can certainly be a component of the creative process, but it's not the whole picture. Creativity involves a broader range of elements and intentions.
So spontaneity might open the door, but creativity is like the whole room. Right. And what about, psychoanalytic ideas? How have those had an influence on DMT?
Well, if we consider the history, traditional psychoanalysis didn't really focus on the body as a medium for art, right? And so DMT really distinguishes itself here by placing the body as both the source of the message, but also the means of transmitting it.
Interesting.
Freud viewed artistic activity as this symbolic way to kind of express and work through our desires, drawing a parallel to, a child's play and creating this fantasy world, essentially.
Yeah.
His idea was that the aesthetic form of art allows us to engage with those feelings that might otherwise be too overwhelming by representing them symbolically.
Yeah, makes sense.
And we even see this in DMT where, for example, adults might use rhythmic foot movements to express, say, aggression in a safe, symbolic way.
Interesting. So the art is like a safe distance, a way to engage without, getting overwhelmed.
Exactly, yeah.
Now, Winnicott, he's been so influential on, therapy broadly. How do his concepts kind of relate to DMT?
Well, Winnicott's contributions are highly relevant here. His ideas around transitional phenomena, play, and creativity, they're all particularly important for DMT.
Yeah.
And he proposed that this capacity for what he called creative apperception, this kind of imaginative and personal way of experiencing the world, is essential for feeling that life is meaningful.
Right.
And he described how, in a sense, a baby creates the comforting presence of the caregiver in their mind, even when the caregiver is physically absent, right? And to cope with this absence, the baby also develops their first symbol, what he called a transitional object. It could be a favorite blanket or something.
I see.
And, both Freud and Winnicott kind of highlighted that these experiences of absence, within a tolerable degree, they're actually what fosters the development of symbols, which then lead to new understandings and this kind of continued drive to create as a way of coping and finding meaning.
It's like we create in order to deal with absence.
Exactly.
That's pretty powerful. Now, were there any other sort of psychoanalytic thinkers that had an influence on DMT?
Yeah, Code's self-psychology offers another perspective. He focused on how those unmet needs that relate to our sense of self can be reactivated in therapy through the therapeutic relationship, right?
Yeah.
And he emphasized this critical role of the therapist's empathetic responses in helping that individual to kind of repair a damaged sense of self. So in DMT, this could manifest in the therapist's attuned movement response to the client's movement, kind of offering this reparative relational experience.
A new kind of connection to help heal those old wounds, right?
Scott.
Okay, so shifting gears a little bit here, we hear the term embodied cognition a lot. How does that theory, how does that idea inform the practice of DMT?
Well, the enactive approach, which is a key aspect of embodied cognition, offers a really insightful way of looking at this. It essentially proposes that we can only know by doing, right? So this perspective really challenges the idea of the mind as separate from the body. That the mind just represents the world through abstract symbols.
Right.
It suggests that our mental processes are actually deeply rooted in our physical sensorimotor experiences and are, inherently linked to our environment. So it's this constant interplay between our brain, our body's actions, and the world around us that shapes how we think and feel.
Right.
And this fundamentally shifts how we view the mind in therapy, putting the body right at the center of our understanding and our interventions.
Our mind isn't just in our heads, it's like our whole being. And that leads us to, speaking of that physical experience, how does DMT specifically work with that connection between movement and emotion?
What's particularly interesting is this really intrinsic link between our human movement patterns and our emotional states, right?
Mm.
Think about how your body responds when you're feeling sad versus when you're feeling joyful. DMT helps patients to consciously explore new ways of new combinations of muscular activity and breathing patterns.
Yep.
And this can be a very direct way to actually regulate and adjust emotions, essentially relinking sensation and meaning. As Freud said, a key aspect of therapy can be to bring our feelings and their associated meanings back together when they become disconnected.
Interesting.
And working with the body, and movement in particular, can really facilitate that integration of the psychological and the physical.
Makes sense. It's like a very direct route to kind of getting to those emotions through, how we express physically. Okay, so we know the therapist-client relationship, huge in any therapeutic approach.
Yeah.
How does that dynamic specifically kind of play out in DMT?
Well, Marion Chase's relational approach, that was really foundational here. She emphasized this idea of the therapist reflecting the client's movement patterns,
Right.
right? Establishing this nonverbal dialogue through our senses, through our bodies.
Yeah.
And this mirroring and attunement, they help to build trust, right? They create a sense of safety, which is crucial for that client to feel comfortable exploring those difficult conflicts that they're, dealing with.
Okay.
And so you have these concepts like kinesthetic empathy, which is the ability to kind of feel what another person's feeling through movement, affective attunement, which is like a deeper resonance with their emotional state, and then co-determination, which kind of acknowledges that shared influence in the therapeutic process.
Right.
And even some theories suggest that, mirror neurons in the brain might play a role in our ability to understand and respond to others' feelings on this kind of kinesthetic level.
Wow, so the therapist isn't just like passively observing, they're actively engaging and like resonating with the client's movement
Exactly, yeah.
on a physical level.
Right.
And then there's this thing called the basic a case model. Can you unpack that for us a little bit? What does that framework involve?
Well, BASIC, yes, it stands for body attitude, selfhood, communication, and interpersonal dynamics. And it provides this really structured way for the therapist to understand the individual and their kind of social interactions within DMT. So body attitude, it refers to the client's relationship with their physical self,
Yeah.
right? Selfhood encompasses their sense of identity, their boundaries. Communication looks at how they express themselves verbally and non-verbally. And then interpersonal dynamics, that examines their patterns of relating to others.
Right, so it's like a holistic view of the person.
Exactly, exactly. And ultimately, as in any form of therapy, building that strong therapeutic alliance in DMT relies on elements like validation of the client's experience, setting goals that are realistic and collaboratively agreed upon, respect for their process, fostering their potential, providing encouragement. And, sometimes the therapist's appropriate self-disclosure can actually play a role in strengthening that alliance.
Okay, so that genuine connection, again, really important. And it's interesting, that group movement in DMT is seen as more than just, adding up the individual movements, right?
Right.
It actually can lead to kind of new ways of processing emotions and even thinking. Now, DMT, obviously, not one size fits all. So how is it applied when you're working with different groups of people? Let's start with, people with eating disorders.
Yeah, this is a really significant area. Individuals with eating disorders often have a really hard time acknowledging and managing their emotions, and they can really experience a profound disconnect from their own bodies.
Right.
DMT can be incredibly helpful here by providing a safe way to transform those often rigid and controlling behaviors associated with the eating disorder into more expressive movements.
Yeah.
And this process can help to foster a connection with those underlying feelings and contribute to more lasting change. Because these individuals often find it challenging to express their emotions verbally, DMT offers this alternative pathway to begin experiencing and expressing those feelings through body language, which can then lead to a greater understanding of, those broader emotional issues and coping patterns at play.
So it's like movement becomes the bridge back to their emotional experience.
Exactly.
That's really cool. Okay, what about how DMT is used in family therapy?
Well, in family therapy, DMT can be really powerful for kind of making visible those often unspoken dynamics and communication patterns that happen within a family.
Yeah.
Concepts like the importance of maintaining healthy boundaries between generations within that family system, those become very apparent through the movement interaction.
Better.
Often, the use of co-therapists, maybe a male and a female therapist working together, can offer a more balanced perspective.
Right.
Therapists might use specific spatial arrangements or guided movement exercises to bring underlying family issues to the surface, to increase their conscious awareness of these patterns.
Yeah.
Like a therapist might ask family members to physically represent their roles, their sense of closeness or distance, through where they position themselves in the room and how they move in relation to one another.
Wow, that's so interesting. It's like you're kind of bypassing all the verbal, all those defenses, and you're getting to the core of how they really interact. Okay, what about working with kids? How is DMT adapted for, very young children?
Well, when you're working with young children, the fundamental principles of DMP really emphasize the child's unique and often nonverbal ways of moving.
Yeah.
The therapist's primary role is to be highly attuned to and to mirror those movements. And a common approach involves a kind of four-step process.
Mm.
First, the therapist will carefully observe and match the child's movements, mirroring them. This helps establish that nonverbal connection and leads to a kind of movement dialogue. Then, the therapist might gently explore and expand on those movements, kind of introducing new possibilities. And finally, if the child is developmentally able, the therapist can help bridge the gap between that nonverbal movement expression and verbal communication about their experiences. Attunement and mirroring are key techniques here, really allowing the therapist to kind of try on the child's movements and connect with their emotional world.
It's like movement is the language, especially before, they can really talk. Now, what about DMT in medical settings? That seems like a whole different ballgame.
Yeah, it is. In medical settings, DMT is often adapted to those specific needs of patients who are dealing with, illness and treatments.
Yeah.
Therapists might use a kind of brief 3 or 4 question framework to understand how that illness and its treatment are affecting the patient's sense of self and their ways of connecting with others.
Right.
So, the therapist is trying to understand who is this person, beyond the diagnosis, and how are their current circumstances impacting their behavior and their, emotional state.
Okay.
Given that our bodies are multisensory, DMT in this context often incorporates that multisensory aspect, which can be very beneficial in areas like pain management, reducing anxiety, things like that.
Okay.
And we even see, a case study of an 85-year-old woman with dementia where they used improvisational DMT with music and even video feedback to help connect with her sense of self and facilitate these moments of recognition and engagement.
Wow. So it can even reach people who have, significant cognitive challenges.
Exactly, yeah.
That's pretty remarkable. Okay, last one. How is DMT used in the rehabilitation process for folks who've had acquired brain trauma, AVI?
This is a really crucial area where DMT can have a huge impact. It addresses this complex range of physical, cognitive, emotional, and social difficulties that can result from a traumatic brain injury or a stroke.
Okay.
And given the brain's remarkable capacity for neuroplasticity, that's its ability to reorganize itself, form new connections throughout life, DMT can play a vital role in that recovery process.
Wow.
Interventions can range from group sessions that focus on things like, grounding, body awareness, proprioception, rhythm for stroke survivors, to more individualized work for those with severe TBI that might focus on really basic functions like eye focus, fostering self-awareness, things like that.
Okay.
There's this, very powerful example of an individual with ABI who, after participating in DMT sessions, said, "I discovered I had a body."
Yeah.
It just highlights the profound impact that it had on their fundamental sense of self and physical presence.
It's amazing. Like that connection between movement and our sense of who we are is so powerful.
Yeah, it's really fundamental.
So a really central part of, what DMT practitioners do seems to be analyzing the movement itself. We hear a lot about Laban's theories. Can you give us, like a breakdown of some of his key ideas?
Well, Laban's work provides this really comprehensive language for understanding movement. He identified 4 fundamental motion factors: space, weight, time, and flow. And each of these factors has these 2 contrasting qualities,
Okay.
So, for example, with space, movement can be direct, moving in a clear path toward a goal, or flexible, kind of exploring the space more indirectly. With weight, movement can be strong or light. In time, it can be quick or sustained. And with flow, movement can be bound, feeling controlled or free, feeling, more unrestrained. And laymen believe that these factors, this is how our inner impulses and energies become visible in our movement,
Okay.
whether we're conscious of it or not.
Right.
These aren't just random movements. They often reflect our intentions and our inner states. He also identified 8 basic effort actions, things like punch, float, dab, and glide. And these can be really useful in DMT because they can often bring those underlying feelings being expressed in a patient's movements into clearer awareness.
Gotcha.
For instance, working with a patient whose movement was dominated by quick time, bound flow, and direct use of space, introducing movements with a strong weight quality, that actually helped her to connect with a sense of, intention and personal power.
So by, carefully looking at these different qualities of movement, you can start to understand the client's internal world and also maybe introduce new possibilities to help them, express themselves in different ways.
Exactly. And give them more options, expand the range of expression.
Okay, that's really interesting. What about the Kessenberg movement profile? Is that like a more specialized tool?
The KMP, yeah, it's definitely a more detailed, sophisticated tool for notating, classifying, and then interpreting movement patterns. Judith Kestenberg and her colleagues, through their research, they established links between the dominance of specific movement patterns and particular developmental phases, as well as, psychological functions.
Okay.
So it looks at things like tension flow rhythms, which are believed to correspond to different stages of, early development, and shape flow design, which reflects an individual's kind of characteristic style of relating to, others and the world.
Okay.
The KMP can provide really valuable information about, someone's inner psychological organization, and it can even be used to compare movement profiles between individuals, like between a parent and child, to gain insights into their patterns of interpersonal, harmony or potential for conflict.
That's really interesting.
And, for example, observing a patient's tendency towards a pacing movement, this kind of start and stop rhythm in a group session,
Yeah.
that might inform how the therapist helps them to, channel that energy in a more constructive way.
So the KMP, it's like movement is almost like an embodied history.
Exactly, yeah.
Rooted in our, development early on. Very cool. And then there's emotorics. How does that kind of fit into the landscape of movement analysis in DMT?
Well, emotorics, also called the body movement mind paradigm, offers another psychomotor model, and it's specifically focused on analyzing our emotive motor systems. It emphasizes the foundational role of these, early archetypal physical interactions between mother and child, this concept of core potentials for movement. And it uses this kind of structured binary matrix of emotive motor psychodynamic markers.
Okay.
So it looks at these early motor prototypes. These are movements that are naturally compatible with being held and nurtured, within what they call a parental envelope. And it looks at how those develop into those later P1 potentials as motor skills mature.
Right. So it's looking at those very early patterns.
Exactly.
And how they affect us long term.
Right. And there's a case example that illustrates how this emotorics perspective helped to understand a patient's really strong resistance to certain movements as potentially originating from a very early pre-verbal body memory of like a medical intervention, rather than solely attributing it to later psychological trauma like sexual abuse.
So it's adding this whole other layer of understanding.
Right.
Really interesting. Okay, so as DMT practitioners are working with, more and more diverse populations, how important is cultural awareness?
It's absolutely fundamental. Nonverbal communication, including movement preferences, interpretations, that's all shaped by culture. These things can function as these subtle, often unconscious, hidden social codes. And research done in different cultural contexts has shown how these norms can influence things like the dynamics in, say, student-teacher relationships. It really emphasizes the need for therapists to be deeply aware of their own, embodied cultural assumptions as well as the backgrounds of their clients, right? What a therapist from one culture might interpret as an individual preference or emotional expression could actually be this deeply ingrained, psychocultural pattern.
Wow. So it's about moving beyond, just a Western lens and really appreciating the range of ways culture shapes us.
Exactly, yeah.
Okay, so last thing here, research. What's the current state of, research in DMT, and what are some of the key challenges and opportunities?
Well, there's definitely a growing recognition of the need for more rigorous research to further demonstrate the effectiveness of DMT, and that's a positive trend. we're seeing a broadening of, the research methodologies within human sciences. There's more acceptance of qualitative and artistic-based research methods, which are particularly well suited for, capturing those nuances of DMT.
Okay.
However, surveys of dance movement therapy professionals indicate that while there's this general agreement on the importance of research for, the field's credibility and advancement, many practitioners report that they feel it has limited direct relevance to their day-to-day clinical work.
Interesting.
And that's often due to various practical barriers like a lack of personal interest in doing research, limited access to funding, they might not have sufficient skills or training, or there's just this lack of supportive infrastructure.
Yeah.
And so encouraging individuals to, engage in research activities and fostering more collaborative research initiatives, those can be really key to overcoming those challenges.
Makes sense.
It's also worth noting that formulating a research question often requires you to step back from that immediate focus on the individual client's needs, right? And instead identify those broader patterns and potentially unfamiliar perspectives. And this shift can sometimes create, a sense of internal conflict for clinicians who are primarily focused on those one-on-one therapeutic relationships.
So it's a balancing act.
Yeah, absolutely.
Okay, so as we wrap up this deep dive, maybe let's just do a quick, summary of the key insights that we've looked at.
So at its core, DMT is this dynamic and evolving field that really leverages that inherent connection between movement and emotion to promote therapeutic change across, such a wide range of individuals and settings. It really beautifully integrates art and science. It emphasizes that relational aspect of therapy, and it uses a variety of really insightful frameworks to, understand the meaning behind movement patterns.
Yeah, and for me, one of the images that just sticks out is Marion Chase starting those sessions with, something as simple as a waltz.
Right.
So gentle and, a great starting point.
Yeah.
Or that moment when the individual with a brain injury through DMT, is able to articulate, I discovered I had a body.
Exactly. And for you listening, if you were seeking this kind of efficient yet thorough understanding of DMT and those aha moments, I hope that this deep dive has given you that. That's given you this new lens to look at the human experience and see the potential for healing and growth through movement.
And so that brings us to our final thought for you to consider. Think about how your own body, instinctively responds to different emotions. Maybe, a clenching in your stomach when you're anxious, or a lightness in your step when you're feeling joyful. What new perspectives does the idea of dance movement therapy, what new perspectives does that offer on your understanding of yourself and those around you? Or maybe, thinking about this deep connection between movement and our inner world. How might you intentionally engage with movement in your everyday life, even in small ways, and how might that affect your emotional well-being? It's definitely something to think about. Thanks for joining us for this deep dive.
Thanks for listening.